In the past several years, the U.S. military has seen suicide rates increase significantly, and officials say more needs to be done to address mental health. Channel 8's Matthew Mittleiter has the story tonight for us.
In the last 7 years, the suicide rate among active duty service members has spiked more than 40%, according to the Defense Department. In 2020 alone, the number of suicides went up by another 15%. U.S. military leaders and officials have attributed that jump to the pandemic, saying it added stress to an already strained force. I spoke with Pastor Tom of the People's City Mission, who's been working with veterans at the mission for over 20 years.
What I've seen with the veterans I've worked with is a growing sense of despair. I'm not sure why, but you see more and more of it with folks that come here. You see a lot more depression, just almost a hopelessness sometimes among some of them when you talk to them. And I think it's a growing problem. It's a serious problem.
A 2021 study from the Cost of War Project says about 30,000 active service members and veterans of the post-9/11 wars have died by suicide. That's more than 4 times the amount that have died in actual combat operations of the post-9/11 wars. Researchers from that study say several factors led to this point, such as high exposure to trauma, stress, military culture, continued access to guns, and the difficulty of reintegrating into civilian life.
When you feel that, you're not sure kind of where to go, and I see that among the some of the vets that are here, and it's something our country needs to really deal with, because these folks have served our country, and for whatever sets of reasons they're having a hard time of it.
The military has issued guidelines on handling mental health issues, but many soldiers fear the stigma that comes with opening up.
I think what you do is you just try to form a relationship with somebody. When they're feeling guarded, you simply just try to become their friend. You don't deal with the issue head on. You deal with things that are maybe less serious. You just try to make a good friendship, a good connection, and then sort of lead into maybe some of those issues over time when they feel like you're on their side.
Pastor Tom says he thinks the military could solve this issue by expanding access to counselors and mental health professionals to help military members cope with the things they've experienced. Reporting in Lincoln, Matthew Mittleiter, Channel 8 News.
And we want to let you know the Nebraska Department of Health and Human Services has a list of resources. You can find that link in this story on our website, klkntv.com.